What I wanted to stand back and do was to reflect on what has been a golden age for global health the last 15 years and try and dissect what went wrong with it. And I think the MDG agenda was part of what went wrong with it for several of the reasons that Martin touched on. I wanted then to talk a bit about the post-2015 agenda and whether it's any better. And to really highlight the importance of the interplay of the global and the national in global health, and whether actually what we really need is a bit more dose of the national in global health, rather than, I'm not opposed to universal goals at all, in fact they're really important, but there may well be a strong argument to be made in line with what Martin is saying about building local capacity, pay more attention to local and national voices as part of the post-2015 agenda. I also wanted, as part of this talk, to reflect on use of statistics and data, because population health sciences do talk about these things, and especially in relation to what went on with the MDGs and what might come next. Well, those are the Sustainable Development Goals, which I'm sure you've seen. Health underpins all of them, or health is related to all of them. The health impacts coming from all of these potential areas. I'm going to concentrate on goals 1 and 3 related to poverty and directly to health. Here is the set of goals for the overall goal, and then the sub-goals for ending poverty in all its forms everywhere. Very interesting phrasing. I don't know whether you've discussed that at all this morning. We are supposed to be eradicating all, that there will be no people, I was going to say eradicating all people living on less than $1.25 a day, that clearly isn't right, but ensuring that there is nobody at $1.25 a day. Purchasing power parity in the year 2030. Of course, the international poverty line has recently been raised again by the World Bank to $1.90 a day. But the numbers effectively remain the same. This was an excerpt from one of the UN's yearly updates to progress on the Millennium Development Goals, and I just want you to absorb that slide for a minute and its slogans and indicators. This is when $1 a day was the original international poverty line. You'll see that there. And then we'll have a look at some statistics. So statistics in relation to poverty reduction show that in the developing world as a whole, the green bar in the top segment, the top third developing region segment, shows the target that had to be reached by 2015, a 50% reduction in extreme poverty by 2015. And for developing regions, you can see the 1990 figures, it's 47% of the developing world were living in less than $1.25 a day. We reached the target actually before 2015. Then I've disaggregated that into 2 sub-regions, and you can see that of the developing world, East Asia, by which we mean China in this case, and Sub-Saharan Africa. And there again you can see that China reached the goal well in advance of the 2015 target, Sub-Saharan Africa not at all. So having absorbed the previous slide, I suppose I'm interested in this slogan and this theme of the universal versus the local, or the global versus the national. We can end poverty. Who do you think we is? Actually, maybe it's got mostly to do with the Chinese government and Chinese anti-poverty policies and the policies of their national government. This becomes especially important talking about issues of poverty and inequality. There is no world government who will drive changes in poverty, let alone inequality. These things happen within countries and happen because of political agreements within countries. Really, this sloganising, we can end poverty, is to make us feel better, because I think we are the we. I think we know who that we is referring to. The other point about these statistics is the dreadful position of sub-Saharan Africa. And you'll see this replicated forwards in the 2030 projections as well. Jan van der Mortele was the head of social policy at UNICEF, and he was one of the designers of the Millennium Development Goals. And in 2009, he wrote an article lamenting the use of the UN, by the UN, of these type of representations, because he says they are mistaken. Van Mortele argued, we set the Millennium Development Goals, the target of 50% reduction over the 1990 baseline by 2015, on the basis of previous global historical trends. What we have done, and the UN is as guilty of this, or was as guilty of this than ever as everyone else in relation to the Millennium Development Goals, was to impose that global target based on previous global historical trends on regions and nations. And hence you can see the 50% target imposed on China and sub-Saharan Africa. And what he said was this generated a huge amount of Afro-pessimism. Statistics and data can be used in all kinds of different ways, but they can redraw our image of the world. Wouldn't it have been more appropriate, and it certainly wasn't the goal of the Millennium Development Goal designers, to actually set national targets on the basis of more realistic national poverty trends? Well, maybe you can debate that with me afterwards, rather than on a global basis. Those were his words, which I've just summarised. Now, this was actually realised in the setting of the Sustainable Development Goals. This was the high-level commission in which David Cameron was on a few years ago, where they concluded that setting the same targets for everyone, as happened with the MDGs in practice, though interestingly not by design, they admit that Van Mortele was right, will not work because many countries have different starting points. But in a few cases, and this is where it becomes interesting to the reconfiguration under the Sustainable Development Goals, the ambition for the whole world should be the same, to establish minimum standards for every citizen. And this is what has happened with the SDGs. We go back, if you remember, that is the eradication by 2030 of everyone living, of all people, getting rid of poverty by 2030. How are we doing at the moment? Well, these are the figures. The poverty rate is declining in the world as a whole, and numbers are declining as well. Projecting forward to 2030, what do we see? Well, if we maintain an average economic growth rate of 4%, we'll get down as a world to 3% of the world's population living on less than $1.90 a day by 2030. That isn't eradication, and that's on very, very optimistic growth projections as well. But what you can see there is that the situation in sub-Saharan Africa will be very different from the world as a whole. But maybe in this case, by having the target as eradication, it's quite important. I don't think people really understand the $1.9 a day purchasing power parity line, because lying beneath that line is a level of human decency which is totally intolerable anywhere in the world. But I suppose what we can see here is that sub-Saharan African populations are going to be way off. So I wanted to talk also about health and some of the things that went wrong with the health agenda. And here you can see the goal 3, Martin touched on them. This is the list, the beautiful list of different sub-goals for the overall goal of ensuring healthy lives and promoting well-being for all ages. What you can see is the difference from the directly health-related MDG goals, which were focused on 3: reducing child mortality by 2/3, maternal mortality by 3/4, and halting and reversing the spread of HIV, malaria, and TB. None of these did we achieve, although there was significant progress in relation to HIV. I wanted to focus on one particular graph, and this is This slide from the Lancet Medical Journal has done exactly what Van der Mortele said shouldn't be done. Imposed a global maternal mortality target of 3/4 reduction on every single country in the world, and then said, well, how long will it actually take countries to achieve that target? And in this sense, it's quite instructive, because all of the countries in red will only achieve the maternal mortality target, that 75% reduction, by 2040. And this was from a few years ago, this data was calculated. Why is maternal mortality interesting to me? Because you cannot deal with maternal mortality in the way you can deal with measles. It's a complex process, and you need to reach out to hard-to-access populations, and you need to have an integrated health system.